first I would like to ask for your permission, both of you, to use this video for educational purpose and on the internet.
Absolutely, yes.
Thank you.
Yes, you have it.
So tell me, first you and then maybe both of you, and what were your symptoms before the surgery?
Could hardly walk. Major pain going up and down my leg.
Okay, especially the leg pain, 1 to 10, how bad was it?
Pain was a 10.
Okay,
Yeah.
She's saying what, so, and what did you notice, what he could do and what he could not do before the surgery?
Well, he could not walk for distances at all.
How far
And,
could he walk? Like a block, half a block, 20
not-
yard?
We were talking feet.
Feet,
I would say
okay.
maybe about 20 feet or so,
No.
and he would have to stop. And it was so bad that where I saw it the worst was when we were walking to a hockey game. The wind was blowing. It was about, I would say, a 30 below wind chill factor,
Okay.
and he was having to stop
I know.
because of the leg pain.
Oh, yeah, how long has that been going on, that problem?
That bad, about 2 years, couple of years.
2 years,
something like that.
so years.
Yeah.
How does one live with that kind of pain for that long?
Be stubborn, I guess.
Yeah, yeah.
It really affected our life,
Yeah.
our social life,
I can imagine that.
our any activities.
Yeah,
That's it was
Many-
hard.
Many patients tell me as well that really affect the mood, and the relationships and so on. Everything goes about around how to live with that pain.
Yeah.
So now we notice you have a scoliosis, you have a bad back, and we did about 1 month ago, we did that surgery for you. First, I'm going to swing here and show what we did. We did a 4-level fusion, OLLIF, minimal invasive, and I'm going up and down here. We see that everything, all the hardware is in good position. For all practical purpose, I don't see any side bending or scoliosis of the spine anymore, and all the hardware are in great position. Let's talk a little about the surgery. Surgery was just about 1 month ago.
Yeah.
When after the surgery did you walk? How long did it take you to walk after the surgery?
After the surgery, I walked a little bit the first night, and then the next day I was walking quite a
Okay,
bit.
and you went home when after the surgery?
Pardon?
When did you go home after the surgery?
The next day.
The next day. So even with the 4-level fusion, you went home next day, which is after open surgery unheard of. After 4-level open fusion in your age group, almost nobody goes home. Now, when after the surgery, were you able to do your basic daily activities?
You know, getting up, making coffee, going up and downstairs.
Yeah, yeah.
I was doing that right away. Yeah.
Right away, right away.
And before the surgery, going upstairs, especially the one was I had really struggled with that. Now there's a struggle, but it's a whole lot better. Let's put
Whole
it that
lot
way.
better, yeah. Now, yeah, please.
I'll just say how there'd be time I'd sit at the top of the stairs and see him. It would just kind of pull himself up on the railing, and that was before surgery. Whereas now he holds onto the railing, and he might have his cane, but not a. He will hold on to the railing.
Yeah. Do you guys
And
go
not pulling-
grocery shopping and so on? How have you observed him to walk now comparing to before the surgery? What do you notice?
He's still using a walker or a cart. Still
Okay.
is
Yeah.
beneficial. He likes
Okay,
that,
okay.
and I do think his balance hasn't come back yet.
Yeah.
And I
So, may I ask you how old you are?
I'll be 74 in August.
74. See, you are not one of the OLLIF's best results, because OLLIF best result is after a month, most of the symptoms are gone and so on, but you are a representative for somebody your age group who got this massive surgery, which is literally one more level and then your entire spine would be fused.
Now,
So for somebody who got this kind of big surgery, you're a representative. That's why I appreciate your testimonial. So some activities are still painful to you. But
well, I haven't tried, extended walking yet. Obviously, bending over. I'm not supposed to do so
you're not
much anyway.
supposed to do that, yeah. No, but I understand already significant improvement. And just the fact that you went home just next day after the surgery is a big deal, especially with COVID. Every day more in the hospital put you at more risk. You told me a few things though. You told me you're already cutting back on the pain medication.
Yeah.
And that by itself is a fantastic kind of results that already 1 month after this big surgery, you're cutting back on the pain medication. And surgery, do you still have leg pain?
No.
No. Since the surgery, the leg pain that you had before the surgery is gone.
Right.
Is that correct?
Yeah.
And when did that leg pain go away? Right after the surgery, or did it take a few days to go away? Have you noticed it since the surgery?
I was in such pain that I don't remember for sure.
Yeah.
But it went, that went away probably right away.
Right away.
Yeah.
And this is extremely important information because shows that the surgery really worked. Not now we are dealing with the healing process of the surgery itself. Please, you wanted to add something.
I was just going to ask, there was one time you walked down to the mailbox, and I would say, I don't know how far that is. I would say maybe about a quarter of a block.
Okay.
Did you have leg pain that day?
No, what happens? Is in walking, and I have more trouble walking with the walker. I use the walker to go down to the mailbox, and it's about probably 75 yards. I get a little weak in the back,
Yeah.
and I did stop once on the way back, just to kind of rest a little bit, but.
So I understand with that amount of walking, your back get tired. That's still maybe too much. 1 month after the surgery or a few weeks after surgery for this big surgery. But did you have sharp pain in your legs at that point?
Oh, no.
Good. That's all what is important as a prognosticator, that the future is good. In your situation, your age group and this many levels of fusion, most of my patients report that they notice most of the improvement in the second month.
No.
So we are 4 weeks out, exactly actually 4 weeks out. So we are expecting for you to start getting better and better. And you are telling me as well that you are noticing you are getting better. Is that? But most of my patients in this situation report to me that most of the improvement came in the second month, not in the first month. So this is a very representative for what you went through and what to expect. Okay, well, I'm hoping that next time you come here, we'll get another testimonial and follow up on this to see how the improvement is. But
let's see. How long am I supposed to wear this back brace?
Well, usually we say 1 month when you walk, 4 months when you're in a car. But slowly you can start weaning yourself off that.
You said you need this. I have this
Spinal-
bone stimulator.
Bone growth stimulation device.
How long do I use that?
That is usually 6 to 9 months.
6 to 9 months?
That's correct. Okay.
Okay.
Okay. Any other question?
The only thing that I was going to add is that if somebody is ever going to have this surgery, to let them know he was in great pain that first day.
Oh, jeez.
Back there, some of our patients are not in that much pain, but you got, let's count them. Sometimes it can happen. You have 10 screws, each of them size of my index finger, and look at that. That's actual size of the screw. And
is it really?
Two big rod. You see those rods there? You got all of that, and it is unrealistic to expect having no pain after having all this. So your situation wasn't that you're a scoliosis patient and you lots of hardware in. Your situation wasn't a regular case. So yeah, sometimes people are in pain.
Oh, that was.
One of the reasons people are in pain in our surgery is because the way we treat the tissue is alive but is offended because we put holes in it. Okay, most of our patients, if it's just 1, 2, 3, 2 levels, there are less kind of holes that we have to poke in.
Okay.
But, dead tissue have no pain. So if you would cook the tissue like many open old-fashioned surgeries, sometimes that's actually right after the surgery is less painful, but for next 10 years it's going to be more painful. Our surgery is the opposite sometimes. We initially, because the tissue is alive, is going to complain, but within few weeks, within few days, sometimes people start getting so much better, so much faster.
Oh, I did too.
So and here you are. So even though most of our patients they wake up and the pain get better so much faster. Sometimes, especially if you do like 4 level or so many levels, it can be painful at first, but nevertheless, you still went home next day. So meaning that the pain did get better within
It
the,
was night and day.
yeah.
From that first day to the next morning.
Sometimes that's
Yeah.
how it is. And that is extremely good feedback. Thank you so
Yeah.
much, okay? Well, thank you so much for the interview, okay?